This is the basis that characterizes our response since the advent of COVID-19 in our country. Both my departments of Science and Innovation and Higher Education and Training took note and took to heart the call by President Cyril Ramaphosa and leading clinical experts that while the rate of infections has slowed, however, with greater liberty in the movement of people, there remains possibilities of community-based and or regional spikes of COVID-19 in the foreseeable future. Let me start by outlining interventions that have been made by the Department of Science and Innovation and its entities in dealing with COVID-19. The Human Sciences Research Council, the HSRC, is in the final stages of preparation for a study to determine the extent of COVID-19 infection in the general population with age-specific prevalence, as determined by seropositivity, meaning giving a positive result in a test of blood serum. The proposed study will use 2 waves of cross-sectional population-based household surveys. The study will be implemented in all the 9 provinces, and the survey will target all locality types, urban areas, rural areas, as well as informal settlements. As a Department of Science and Innovation, we are an active participant in the Health Ministerial Advisory Committee, which is looking at the manufacturing of the COVID-19 vaccines as and when it is found. It is envisaged that the first successful vaccines will be delivered in early 2021. However, the upscaling of the manufacturing pipeline for hundreds of millions or even billions of doses will also require intense collaboration and needs to be done in such a way that it will not compromise the production of other essential vaccines. In order for South Africa to be able to secure early access to and delivery of safe and effective COVID-19 vaccines and treatments as soon as they become available, we will be developing and implementing a comprehensive COVID-19 vaccine strategy, which amongst others will ensure that there is sufficient supply of a safe and effective vaccine to achieve population immunity to COVID-19. With limited vaccine manufacturing capacity around the world, South Africa will have to prioritize its own requirements in the interest of securing access to the vaccine as a matter of national security. We'll be expanding the current BioVac operations. This is a company that is majority owned by government through our Department of Science and Innovation. We'll be expanding its operations to produce the drug substance required to act against the COVID-19 virus. BioVac is a public-private partnership company formed by government and the private sector in 2003 to produce local vaccines in South Africa. It predominantly operates in the downstream part of the vaccine manufacturing value chain, with primary activities geared towards formulation and filling of drug products, as well as final product labeling, packaging, and distribution. So our department is very much part of the effort for the supply of the vaccine as and when it becomes available. Through the HSRC and Higher Health, we are carrying out a COVID-19 knowledge and attitude study in young people, and the results of the online survey are almost complete. We will in due course make the outcomes of the study available to the public. We have also converted the existing health and demographic surveillance operations at 3 rural nodes, namely Bushbuck Ridge Local Municipality in Mpumalanga, and Capricorn District Municipality in Limpopo, and Umkhanyakude District Municipality in KwaZulu-Natal to incorporate COVID-19 telephonic surveillance and case finding. This is very important, by the way, for purposes of tracking the virus and contributing also to understanding its epidemiology better. The operations cover 300,000 residents in these areas. The surveillance measures the impact of non-pharmaceutical interventions against COVID-19 on rural households and individual mental health and supports local health authorities in their fight against COVID-19. We'll also be undertaking the wastewater COVID-19 surveillance work at some Gauteng identified nodal points. This will contribute to an early warning system for COVID-19 resurgence and other emerging pathogens. I'm also pleased to say that we have also ensured that we connect all the 320 plus TVET college campuses to the South African National Research Network, SANREN, at 200 Mbps, allowing access to connectivity, optimization and other services, including post-school infrastructure, data accessibility, monitoring and provision, particularly useful for working off campus. The work is conducted through the National Integrated Cyber Infrastructure System. The Department of Science and Innovation's branding campaign will, among other achievements, be showcasing its work in response to COVID-19. The department, since its inception with 2 white papers on its journey of developing and coordinating a national system of innovation, will be showcasing some of its achievements, especially its contribution in the work of fighting the COVID-19 pandemic. I hope that through these campaigns there will also be a better appreciation of the impact of science, technology and innovation on our society and a greater understanding that science saves lives. Update on COVID-19 interventions by the Department of Higher Education and Training. Starting with deaths in the sector due to COVID-19, by the 22nd of September, we had lost 89 members of our public higher education community to deaths from the virus. Of these, 53 are from universities, and that was 44 staff members and 9 students, and 36 from TVET colleges with 11 students and 25 staff members. We mourn these losses of staff and students in our institutions and send our condolences to the families, friends and colleagues of those who have succumbed to the illness. Our sector welcomes the move and the announcement by the President to Alert Level 1, which will now allow for more contact teaching and learning. I would like to express my gratitude to the exemplary leadership provided by President Cyril Ramaphosa and my colleagues at the National Command Council in guiding our work during this difficult time. I also remain humbled by the commitment of all the members of the Ministerial Task Team, which is led by our Deputy Minister Puti Manamela, comprising of, amongst others, the College Principals Organization, Universities South Africa, trade unions, South African Union of Students, and the South African Federation of South African FET College Students, known as SAFETA, to work collaboratively as we have and continue to navigate these uncharted waters presented by the pandemic.